Welcome to myeyacademy.com. I'm Professor Mahfouz Hussain from Pakistan. myeyacademy.com is a platform for ophthalmic teaching for everyone. In this video, VHB Chapter 10, Section 2, we are going to discuss what's glaucoma suspect, what's ocular hypertension, and what is normal tension glaucoma. Now, first of all, see what is glaucoma. We've already said glaucoma is an optic neuropathy characterized by high intraocular pressure, disc damage, and nerve fiber damage. The nerve fiber damage is detected with the help of the visual fields and OCT. So what is glaucoma suspect? Glaucoma suspect is when the physician can neither confirm the glaucoma nor can exclude the glaucoma. So the patient is a suspect. He may or may not have glaucoma. You need to keep such patient under observation by regular checkups. What is normal tension glaucoma? Remember the definition? For the glaucoma, you need to have high intraocular pressure. But in some people, the intraocular pressure is normal or under 21, but the patient has got a disc damage and nerve fiber damage, and we label that patient as a normal tension glaucoma. So what is ocular hypertension? Ocular hypertension is opposite to normal tension glaucoma. Here the intraocular pressure is more than 21, but the patient do not have any glaucomatous damage, means no optic disc cupping, no visual field defects, and nothing on the OCT. So the normal IOP is actually average IOP, and ocular hypertension patients are actually the high end of the average patients. Now we are going to discuss different scenarios to understand what's glaucoma suspect, normal tension glaucoma, and ocular hypertension. First of all, scenario 1. Now look at this patient 1. Intraocular pressure measured with a Goldman tonometer is 25 mm of mercury. Optic disc cupping is 0.9, and the nerve fiber damage is present on the visual fields and on the OCT. So what this patient has got? This patient has got everything that a glaucoma patient should have. So we label this patient as having glaucoma. Now the scenario 2. Now be attentive. Look at the readings of this patient. Intraocular pressure is 18 mm of mercury. Optic disc cupping is only 0.3, while there is no nerve fiber damage on the visual fields and nothing on the OCT. So guess what this patient has? Normal intraocular pressure, normal disc, normal visual fields, normal OCTs. This patient does not have got glaucoma. So the first patient had glaucoma and this patient does not have glaucoma. Let's move on to the third patient. Look at patient number 3. Intraocular pressure is 22 mm of mercury, which is slightly more than normal. Optic disc cupping is 0.6. Look at that. But the neuroretinal rim is quite healthy. Optic nerve fiber damage. There is no field defect on the visual field analysis, and the OCT is looking normal in this patient. Now this patient has got slightly more intraocular pressure, slightly increased cupping, but normal visual fields and normal OCT. So this is a type of the patient we call glaucoma suspect, that the patient may have got glaucoma but hasn't yet developed clinical signs, so we need to keep the patient under observation. Now let's move on to the patient 4. Patient 4 has got intraocular pressure of 17 mm of mercury, which is very normal and very good. Look at the disc cupping. Disc cupping is nearly 0.9. So it's a very glaucomatous looking disc, and then there's a field defect on the visual fields, and there is a defect on nerve fiber analysis on the OCT of the optic disc. So this patient, though has got normal intraocular pressure, but has got a fully developed cup and the damage on the visual field and OCT. So this patient has got a normal tension glaucoma. Now patient number 5. Patient number 5 has got intraocular pressure of 27 mm of mercury. But look at the optic disc. Cup is very small, nearly about 0.3, and no damage on the visual fields and no damage on the OCT. So this patient doesn't show any clinical damage of the glaucoma, but has got the intraocular pressure which is much higher than the normal. So we label this patient as ocular hypertension. So let's summarize at the end what we discussed. Glaucoma is a triad of high intraocular pressure, disc changes, and nerve fiber damage. Nerve fiber damage is detected with the help of visual fields and OCT. Glaucoma suspect is a patient which may or may not have got glaucoma. So some signs will be in favor of glaucoma, the others will be against the glaucoma, and you cannot decide whether the patient have glaucoma or do not have glaucoma. Normal tension glaucoma is a glaucoma with the normal IOP or the IOP less than 21 mm of mercury. Opposite to that, ocular hypertension is high IOP but no damage seen clinically on the visual field analysis or OCT. At the end, just a starter for the next 2 lectures, which is classification of the glaucoma. Remember glaucoma, high intraocular pressure, disc cupping, and optic nerve fiber damage. Now whether the glaucoma is open angle or close angle, that depends on the angle. Look at the angle here. The angle here, the angle is open, so we call it open angle glaucoma. Look at the angle here. The angle is open, but if the iris moves forward like this, the angle gets closed. Now this is the closed angle glaucoma, and for that you have to do the gonioscopy. So this is open angle glaucoma, this is closed angle glaucoma, and this is what we are going to discuss in the section 3 and 4. Open angle glaucoma is then primary open angle glaucoma and secondary open angle glaucoma, and the closed angle glaucoma is primary angle closure glaucoma or secondary angle closure glaucoma, and this is what we'll discuss in the next 2 lectures. Thank you very much for being with me, and please do give your feedback. Thank you.